My name is Dr. Timothy Quinn, and today I'm going to share some lessons that I learned over the last 20 years of practicing family medicine right here in my home state of Mississippi. But before I go into these lessons, I want to take everyone on an imaginary journey, okay? So everybody before me right now, we're on a plane and we're 2 hours into our trip and we're traveling to our most desired destination. I mean, we're so excited. And with us, we have our loved ones, the people we love the most. And, you know, everybody's just full of enthusiasm. And then all of a sudden, the plane starts going down. And frantically, we hear the pilot announce, "Prepare for impact. The plane is going to crash." And people are screaming and you're praying and all these thoughts are going through your mind. And then all of a sudden, a force appears in front of you. And the force tells you, you can go back 3 hours. That's 1 hour before the plane ever took off. And all of a sudden, you're in the parking lot of the airport. And you have your family with you. But something's different now. You're now empowered with vital information so that you can now make a decision with that information that's better for a more favorable outcome. So, about 2 months ago, I was interviewed by a reporter with the New York Times. And the article was to be on the poor health status of Mississippi. What he shared was Mississippi has one of the lowest health grades. People dying from cardiovascular disease more so than any other state. People dying from cancer being diagnosed at the later stages. And he asked me, as a family physician of 20 years, working in the trenches, working in Mississippi, why? Why, Dr. Quinn? Why is it that you all perform so poorly in your health grades? I shared 3 answers. The first answer was, we have decreased healthcare access. I shared my thoughts on the fact that we don't have Medicaid expansion, which we're working on, but that would drastically help the situation. Also shared the fact that with our social economic status, a lot of Mississippians, if they have health insurance, sometimes they can't afford to pay their copay, or maybe they can't meet their deductible, or even if they make it to the doctor, sometimes they can't afford to get their medications. And also in regard to decreased access, I shared that we have a very low number of physicians, nurse practitioners, and other healthcare providers to patients. We have a very low ratio, which all affect the fact that we have decreased access. Also shared that a lot of Mississippians are living with obesity, living with the status of being overweight that drastically negatively impacts our health grades. And the third fact that I shared, and we're going to talk about that today, is in Mississippi we have a high level of healthcare illiteracy. In a lot of cases, just like on that plane, we got on the plane, we were excited, hey, we're going to have a great time, and now the plane is going to crash, but it's too late. But in the scenario, the imaginary scenario that I gave, there was a force that enlightened the individuals on the plane, but took them back. And they had that key information, that knowledge, that education. And now they were able to make an informed decision and not get on the plane. That force that I was talking about is me. It's you, everybody in this room. Because this room is filled with healthcare providers, it's filled with social workers, nurses, so many people I've met, even healthcare policymakers. We all have a job in his army, in the force. And what I hope that we can accomplish in the next 30 minutes is me sharing some of the things that I've done over the last 20 years that have helped me to become more effective, and maybe some of this information you can use in your work so you can all, as myself, we can all continue to be more effective. So when individuals have to make that decision, and I'm talking about that 42-year-old lady, and she is told, you need to get a mammogram. What I hope is we can encourage her, educate her, and let her know how important it is and what can happen if she doesn't. That way she can make the informed decision to get the mammogram. Or a patient that's on high blood pressure medication to take his medicine and be compliant and avoid that heart attack or that stroke, just like on that plane, avoid that crash that's fatal. So let's go into our lessons. Let's go to the next slide. The 5 lessons. Go to the people. Number 2, use various platforms. Number 3, help people find internal motivation. Number 4, collaborate with other organizations. And number 5, my wife's favorite, have a great time while you're living in your purpose. Let's go to the first lesson. Go to the people. I had a talk with Dr. Sutton recently, and we talked about it. Impact people where they live, worship, work, and play. You might wonder, what do you mean by that? Go to the people, Well, let me tell you, I started learning this lesson before I ever graduated high school. I grew up in Macomb, Mississippi, and I just met one of my neighbors. And my grandfather was a pastor. And every Sunday, he was in church educating his congregation about the Word of God, strengthening them, giving them the information they need so they can make the right decisions in regards to their faith. But on Friday and Saturday night, he was at the nightclub, the juke joint, as we called it back then. And people used to talk about him. They'd say, I saw your granddad at the club. But the deal is, he was there with a purpose. And I didn't understand his purpose at that time. So the way he would present at the juke joint is when people would come out, he'd be standing outside of the club. And he'd have a Bible, and he'd have papers, information. And he'd ask people, he'd say, sir, have you ever thought about learning more about God? Ma'am, do you have children at home? Or, sir, do you have children at home? Sir, do you think it's safe for you to drive in that condition? And that's what he would do every Friday and Saturday night. And I would ask him, I'd say, Granddaddy, why do you go? Because sometimes people would be mean to him. His life would be in danger. And he'd share with me, he'd say, Tim, when you're living in your purpose, you want to go where you can help people that need it the most. He shared that sometimes it's going to be uncomfortable. It's going to be scary. And he really made an impression on me because I understood as I got older, which resulted in, when I got into my 3rd year of residency, I was in Los Angeles, California. And I contacted the Jackson Chamber of Commerce because I knew that God was going to bring me back to Mississippi to start a practice. And I got the address of all the churches in the metropolitan Jackson area. And I sent a personal letter to each church. There were over 100 of them. I'll tell you, back then, we used to write letters. I know a lot of, some of the younger people, you wouldn't know anything about that. But a lot of these churches responded to my request in these letters. And basically what I was requesting was to come to their churches, check blood pressures after church, and talk to their congregation in whatever format they could use me in regards to their health. So when I got out of medical school, when I graduated residency, and returned back to Mississippi, I would go to a different church every Sunday and check blood pressures and talk to people about health. Going outside, going to the people where they worship. But also I would work with my team. We go to their job locations, like Nissan and other jobs. We go to different schools and different rallies. But the take home was we went to the people. But I even took a page from my grandfather's playbook. I started going to the juke joints or the clubs. My wife and I, we have worked with the Mississippi State Department of Health for the last 4 years. And about 4 years ago, we started a campaign for cervical breast cancer awareness with the Mississippi State Department of Health, where we had a grant. And our job was to enlighten Mississippians about opportunities to go get screened, such as a pap smear and mammogram and breast exam. And there were a lot of opportunities where if people didn't have insurance, they can go to these facilities. So I came up there and I said, let's all go to the club. And they were like, what do you mean the club? Well, what we did was we would go to clubs, like, for instance, one evening we went to the M-Bar. That's a club here in Jackson. And we set up a booth, and I had officers from the Mississippi State Department of Health. It was funny because some of them were like, I'm uncomfortable, because they had never been there before. But what we do is they'd come over, we give them information, and they get a ticket. And then my wife and I, we go on stage every 15 minutes, and, we kind of dance, and the DJ say, okay, we got the Quins. And we give out a free gift to whoever could show that they had proof that they came to our table. We give out gift cards. We even had a couple of bottles the club gave us. But at the end of the night, hey, by any means necessary. But at the end of the night, we were able to educate over 350 women about opportunities to go get screened for breast cancer and cervical cancer. And we later learned that a lot of those young ladies, and some of them did not have health insurance, followed up and got screened. We went to the people. Next slide. Use various platforms, lesson number 2. So, using various platforms, this is something that's evolved over the 20 years of being a family physician that I've learned to be very, very effective. Basically, one particular evening about a year ago, I got a really good confirmation that it's working very well. I was in Walmart. I was shopping, and somebody tapped me on the shoulder. I turned around, and it was a lady. She was a little teary-eyed. I asked her, I said, are you okay? And she said, I've never met you in person, but you saved my life. I said, what did I do, ma'am? And she shared that her mother died from breast cancer that had metastasized all over her body. Basically, the history that she gave was her mother did not believe in going to the doctor. And she developed like a lesion in her breast. She could feel it. It was a very hard lesion, but she ignored it for years. And then she started getting very fatigued. She would have just excruciating pain all over. And then the lesion, her breast expressed blood. So she finally went to the doctor. But when her mother went to the doctor, it was too late. She had stage 4 metastatic breast cancer that had spread everywhere. They put her on chemo and radiotherapy. She lost a lot of weight. She lost all her hair, and she just died a miserable death. And the lady that evening in Walmart said, I was convinced that the doctors killed my mother. They were just trying to get money, and I wasn't ever going to go to a doctor. But then she shared, she was driving one day, and she heard me on the radio in her car talking about breast cancer. Then she said, I saw you on television, like 2 days later, talking about breast cancer. She was like, wait a minute, it's the same guy. I know that voice. Then she shared, she saw me on Facebook the next morning dancing with my wife, talking about breast cancer. I said, it must have been October. That's Breast Cancer Awareness Month. She confirmed. But she said what really made her make the decision to go get screened was on one particular Sunday, soon thereafter, she went to church. And she said, I know God sent you. Because she said, you were at my church talking about breast cancer. So she shared that she went and got a physical with the doctor, and she got a mammogram. She shared that she got a call a few days later that the mammogram was abnormal, and she had to follow up. She followed up. They did a procedure, ultrasound-guided biopsy. She followed up for the report. The biopsy showed precancerous lesions, but all the borders were cancer-free, meaning that it hadn't spread. She followed up for a few radiological tests, and her doctor shared with her that had she have not come and gotten that mammogram, that timely mammogram when she did at the age of 41, there was a high probability because of her family history with her mom that she could have very well had the same fate as her mom maybe 3 or 4 years later. I left Walmart that night with a confirmation that using various platforms work. With research, as a physician, I'm a scientist. With research, we learn to study data, study results. And research has overwhelmingly shown that if somebody sees something multiple times, there's a better chance that they'll remember and adhere to the advice that's being given. But if they see it on different platforms, it has even more of an impact. So this is something that you can consider as you go through your journeys helping fellow Mississippians. Next slide. Lesson number 3, help people find internal motivation. I had a patient that followed up with me about a year ago. And the reason he came to the clinic was he had an upper respiratory tract infection. But when I looked at the chart, his blood pressure was severely elevated. And I did a little research and looked back. The last time he had come before that was 2 years prior, and his blood pressure was severely elevated then. I noticed that we prescribed medication. We tried to follow up. We sent him a letter. We called. He just fell off the map. And when I asked him, I said, well, Mr. Joe, why did you not follow up? He shared that he came in. I told him he had high blood pressure. I told him he needed to take medicine. And he took it for about a week. And he didn't feel any different. He said, I felt fine, doc. Plus, I heard the medicine, it can mess with my manhood. I said, okay. I see Dr. Turner, he's nodding because that's the main thing we get as doctors. Everybody's concerned about the manhood. But I shared with them that you really need to take that medicine. But he told me, he said, Doc, I'm gonna be honest with you, I'm probably not gonna take it. And then I remember just like yesterday, I heard my wife, give him a reason. Give him a reason to take it. He's not gonna take it just because you said it. Who are you? So I thought about it, and ironically, I had recently met a guy in Orlando, Disney World. And the guy that I met in Orlando, he was a 65-year-old gentleman. And we met at one of the little food things, and we started talking. I told him I was a doctor, and he told me he just retired. he was there with his grandkids. He took his grandkids on a week's vacation, and he was just so excited. The kids were happy. It was just a festive time. But he also shared that about 20 years ago, a doctor put him on blood pressure medicine. And he shared that he's been taking that blood pressure medicine every day, religiously, following up with his doctor every 3 months for 20 years. Now he's 65, retired with his grandkids. Well, that particular day in the clinic, I told my patient about the gentleman I met in Orlando. And I told him that you're 45. That's about the time that he was diagnosed with hypertension. He took his medicine for 20 years, and now he's in Orlando with his grandkids on vacation. I shared, if you don't take your medication, with hypertension being the silent killer, what can happen is over 5 years, you still feel great. 10 years, you might have a little mild stroke, but you'll probably bounce out. But another 10 years, when you're 65, unlike my friend that I met in Orlando, you might not be able to take your children on a vacation to Disney World or your grandchildren. Your grandchildren might have to come visit you either in the hospital or somewhere else. And, you know, it's like I saw a light bulb go off over his head. He was like, so, Doc, what you're saying is, if I take this medicine, there's a better chance that 20 years from now, I'll be around. I said, that's right. Not just for yourself, but for your grandchildren, your wife, and also to enjoy your retirement. He said, Doc, go ahead and write that prescription. And he's been following up every 3 months since, and his blood pressure is now controlled. Help people find internal motivation. Next slide. Lesson number 4, collaborating with other organizations. Now, I also learned this lesson over time, and it evolved to where it is today. Now, earlier we talked about the fact that when I first got back from residency, started my practice, we were doing blood pressures in churches. It was Dr. Quinn and one nurse. And we'd go to these churches, and some churches had over 100 people. Now, you got to think about it. When you get out of church, and you know, we were going to a lot of Baptist churches in the South. When church is over, what's the first thing we want to go do? Eat. That's right, we want to go eat. So I had to fight against food, and I was not going to win. So people would get out of church, and the preacher would say, Dr. Quinn is in the fellowship hall checking blood pressures. And a few people would come back there, line up. I'd check a blood pressure and explain the results and talk to them. But people would, I noticed the back of the line would just sort of feather out and they'd be gone. And we probably checked 10 good blood pressures. I mean, it was important because a lot of those blood pressures were elevated. A lot of those people hadn't been to the doctor in quite a while, and sometimes we had to call the ambulance. But somebody said, why don't you work with other organizations, collaborate? So I went to different schools, and I went to UMC. And they had a program with their schools, the medical school, the nursing school, physical therapy, occupation, all of the schools. They were trying to get into the churches, but they didn't have the relationships. They shared they'd call the churches, and nobody called back or whatever. But when I called, I had those relationships that I had, built for those years. So they said, well, why don't we work together? So now when I would go to the churches, I got 25 students with me. So when church is over, you go into fellowship, you got 25 stations. Now, if each station can do 5 people, you do the math. We could do the whole church. But on top of that, we started collaborating with insurance companies because they wanted to get in the churches to tell about different opportunities. And guess what? Saints, I'll say saints. They would bring food. So the pastor would say, when church lets out, go in the fellowship hall. We got Dr. Quinn and his team. They're going to check your blood pressure, and they have food. Man, we checked everybody's blood pressure. We check everybody's blood pressure. Work, collaborate with other organizations, but another collaboration that was really, really successful resulted from our Children's Health Initiative. And this started about 6 years ago. A child came in with a rash on the neck. The dad shared that the child hadn't had a physical in over 5 years. And I see Ms. Berry back there. She was one of our founders. But basically, I shared with the dad, we really need to do a physical on your baby, because as a family doctor, we want to get that physical exam because we care about our kids. Well, Dad agreed, because I told him, you don't even have to pay a copay, sir. He was like, okay, you got me, you got me. So we did the physical, gave him cream for the neck, but the child failed the vision test. We referred the child to an ophthalmologist. The child was prescribed eyeglasses. A year later, the mother brought the child in for his wellness physical exam follow-up. And she shared with me that the child was failing in school. You know, dads, we're terrible historians. We're the worst. Sometimes when my dads come, but I love seeing my dads bring those kids, I'll call the mom on the phone and put her on speakerphone. And I know Dr. Turner got me on that. But the deal is, she shared that the child was being considered for special ed or going to repeat the year. And when the child got the eyeglasses, now his grades are great. And the little child looked up at me and said, I'm going to be a doctor just like you. And I was like, man. I said, it should be a requirement in Mississippi that all children get physicals. And, you know, I talked to a lot of people, and I wasn't getting anywhere because I'm just one man, Tim Quinn. I mean, who cares what he thinks, right? So what I did was I took a page from my playbook, collaborate. So I contacted the Mississippi State Medical Association, Dr. Clive Brunson, David Roberts. And what we did was we started lobbying, because they have lobbyists. Because you know, they could actually get to the people that make the decisions. So first we got a resolution with the Mississippi House. Then we got a resolution with the Mississippi Senate. We got a proclamation from Benny Thompson, a lot of different documentation. We even got a proclamation from the governor at the time. We got a law that went on the books. It didn't get enough votes, but we're not going to give up. We're going to keep trying. We're going to try to get it back on again, but we were moving. But in addition to that, we also work with the school systems, because we really wanted to have an information campaign about children getting physicals. We work with Jackson Public Schools. Actually, Dr. Cedric Gray, I don't know if y'all remember him, the guy that always wore the bow tie. But he and I, we did a lot of brainstorming, and we came up with a scenario. The older children would write an essay of why physicals are important. The young children at the elementary schools would do a poster. I noticed a lot of those posters had kids getting shots. But then we started working with Hinds County School District and Madison County School District, and we were getting pretty good participation. But then I said, let's collaborate more. Let's call these insurance companies. We got with United Healthcare, Magnolia Health, Merit Health Hospitals, and the Kellogg Foundation, and we raised about $25,000. So what did we do with the money? We gave prizes, scholarships to the children, and we worked with Jackson State, and they helped us grade these essays and posters. And now, to this day, we still have it going on in these school systems where we have hundreds of children. Every year, they have to write an essay of why physicals are important, and children have to draw pictures of why physicals are important. But at the end of the day, you have children, young and old, along with their parents, actively engaged in thinking and articulating the importance of physicals, which we feel very confident will result in children getting physicals. Collaborate with other organizations. Next slide. Now this slide right here, my wife, she had to remind me sometimes. She has to give me a right hook. But have fun while you're living in your purpose. You know, sometimes, honestly, and Dr. Turner, I'm sure he's with me on it, we can get a little discouraged. You know, like my grandfather talked about, it's uncomfortable leaving out of your little comfortable practice or leaving out of your cushy church with everybody that's there just because they came to see you and everything you say, yeah, that's right, Pastor, or that's right, Dr. Quinn. But going out into the community, sometimes it's uncomfortable. It's not fun. But you just have to remember, you have to embrace those times when you have that patient to tell you, hey, I got my mammogram because of what you're doing. Or, you know, some kids saying, I got a physical because I did the essay. Or somebody taking their blood pressure medicine. You have to embrace those times and just enjoy the journey and understand that you can be a part of that force that I talked about, that force in his army, and you can become stronger and more effective, and you can help more Mississippians. Next slide. Now, in closing, I want to share our latest endeavor, which we just started recently. Recently, I just received my board certification, my second board certification in weight loss medicine. Yes. And this is my passion on top of my passion, because I'm getting older. I hit 50 and my wife can tell you I had my midlife crisis. I thought I was going to die. Everything was going to kill me. I've been working out 8 hours a day. But to help people get to a healthier weight, it's such a rewarding experience for me and everyone on our team. And what we formed the Mississippi Obesity Society, and we're an organization of healthcare workers and healthcare advocates that came together to improve the health of our fellow Mississippians. I hope that this information has been very useful to everyone. I hope that you can use some of the tools that I've learned to incorporate into your practice of helping our fellow Mississippians achieve a higher level of health. Thank you very much.